In this video, I will be asking the question, what is macular degeneration and how does it develop? The macula is the central part of the retina or photographic film at the back of the eye and is very important in relation to detailed vision such as reading, writing, recognising faces, and also is concerned with colour vision. The retina, including the macula, functions to convert the focused light that is falling upon it into electricity to send to the brain to allow us to perceive sight. And the particular cells that convert light into electricity are called photoreceptors, and there's two types, rods and cones. And in the macula, it is the cones primarily that are working to convert the light into electricity. There is no bit of tissue in the body that is more sophisticated or working as hard as your macula. From the moment we open our eyes in the morning till the moment we go to sleep at night, the macula, and in particular the rods and cones, are working flat out. And as a result of this, they have to be as efficient as possible as they're working to maximum capacity. So immediately underneath the layer of rods and cones is a layer of cells called the retinal pigment epithelium, and one of its functions, its primary function, is to help the rods and cones with this function of converting light into electricity. And they do this by recycling material. So in order to be as efficient as possible, you need an efficient recycling process, and that occurs between the retinal pigment epithelium and the rods and cones. And because this system is working flat out, it needs a really good blood supply. And underneath the retinal pigment epithelium is the blood supply of this tissue, and this is called the choroid. And it has the greatest blood supply per unit area of any tissue in the body. So we've got the macula functioning very hard with a very good blood supply and working at maximum capacity throughout life. One way to demonstrate how hard it is working is to look at what happens when you faint, usually due to a drop in blood pressure. Immediately you start feeling lightheaded, the first thing that goes before you actually lose consciousness is the vision blacks out. And that just goes to show that immediately there is a reduction in flow in the choroid, the overlying retinal pigment epithelium and photoreceptors can no longer function and the vision fades. So this is a good demonstration of how hard the retina, and in particular the macula, is working. So macular degeneration is the most common cause of loss of central vision in the Western world in people over the age of 55. And there are a variety of mechanisms, and some mechanisms are still not well understood as to why it develops. The first thing we've already alluded to, the retina is working flat out all the time, having to recycle material in order to be efficient. And as we age, the recycling process becomes less efficient and you get a build-up of waste products of metabolism within the retina, and this in itself can cause problems with the vision. We also have light striking on the retina all the time. Light is electromagnetic radiation, and if you have excessive light on the skin, get sunburnt, it's very damaging to the tissues. And with the eyes, this light is not only going into the eye, it's being focused on the retina. And one of the things that can happen with the passage of time is that you can get damage to the DNA, which is the genetic material within the cell, from things called free radicals, which are nasty molecules produced by high energy light striking fatty tissues such as the cell membranes of the cells in the retina. So a combination of factors can increase the risk of the retina not functioning as well as it should. And unfortunately the retina is part of our central nervous system, and because we have memory, that we have a fairly fixed system that cannot repair itself compared to, say, skin or liver. So when damage occurs, there are limited mechanisms to try and repair the damage, and usually scarring occurs. There are other components to macular degeneration, including inflammatory changes within the retina. There's sometimes a genetic predisposition in some patients, and certainly toxins such as smoking can increase your risk of macular degeneration. It's not a blinding condition. The worst case scenario is you lose that central area of vision, but you will always maintain peripheral navigational vision, so you can remain independent, albeit with reduced function in terms of reading, writing and recognising faces and driving. There are two types. There's dry and wet, and this does not relate to watering of the eyes or dryness of the eyes. It relates to what's going on within the retina at the back of the eye, and I'll be talking about these two different types in more detail in other parts of the Eye Expert website.